again. Ako nga pala si Aaron Salilin from BSP2-4 and let us continue where we left off. Ayan, so last time, diniscuss natin yung voyeuristic disorder. This time around, we will be tackling exhibitionistic disorder. Actually, these two paraphilic disorders are closely related, which is why dun sa ating last discussion ay na-include itong exhibitionistic disorder as a comorbidity ng voyeuristic disorder. So, before anything else, ano nga ba itong tinatawag nating exhibitionistic disorder? So, it is more commonly known as flashing nowadays. Ito ay isang form of sexual harassment kung saan yung individual with exhibitionistic sexual interests ay may urge or nakaka-experience siya ng sexual arousal kapag ina-expose niya or fina-flash niya nga sa ibang tao without their consent yung kanyang genitals. It could be your buttocks or your private parts. And ayon dun sa ating DSM, sa ating diagnostic criteria, yung criterion A ay nag-indicate katulad dun sa criterion A ni voyeuristic ay dapat it should persist for at least 6 months and it should be recurrent or yung paulit-ulit, intense or yung matinding sexual arousal after exposure of one's genitalia to a non-consenting adult. Lastly is si criterion B. Unlike sa voyeuristic, meron siyang 3 criterion. Ito ay 2 lamang. So, ang sinasaad naman ni criterion B is same lang din doon sa criterion B ni voyeuristic, kung saan dapat nakaka-experience ng significant distress or impairment with social, occupational, and other areas of functioning yung person na nag-exhibit ng exhibitionistic acts or behavior. So let us move on with the subtypes ni exhibitionistic disorder. So yung kanyang mga subtypes ay naka-classify based doon sa preferred target or victim niya. The first ones are the prepubertal children. These are children within the age range of 9 to 12 years old, so they are pre-teenagers. Next are the physically mature individuals. So in other words, they are adults. And lastly, both prepubertal children and physically mature individuals. So mas malawak yung kanyang range of options of choices ng victim because both children and adults ay kanyang tinatarget. Hindi siya selective sa kanyang pinaprefer na gawan ng exhibitionistic acts or behavior. And of course, hindi mawawala yung specifiers ni exhibitionistic disorder. So yung kanyang first specifier is same lang kay voyeuristic in a controlled environment kung saan limited or restricted lang yung opportunities niya to expose one's genitalia because in occupational settings may mga regulations, may mga rules na ini-impose kaya hindi niya basta-bastang ma-execute yung kanyang interest or sexual interests. Next is yung in full remission. So katulad lang din nung sa voyeuristic kung saan for at least 5 years hindi siya nag-act upon dun sa urges, sa fantasies, sa impulses ng kanyang exhibitionistic sexual interest and therefore hindi na i-impair yung kanyang overall functioning. With respect to the prevalence of exhibitionistic disorder, katulad lang din siya ni voyeuristic disorder na still unknown ang kanyang population prevalence because hindi lahat ng diagnoses na kinoconduct is nasasatisfy fully yung criteria ni exhibitionistic disorder. As such, hindi natin makakonclude kung gaano ba talaga siya ka-prevalent sa ating society. One thing is for sure though, na similarly sa voyeuristic disorder, mas prevalent siya among men compared to women. According to the adult men who were clinically diagnosed with exhibitionistic disorder, their exhibitionistic sexual interest first emerged somewhere between late adolescence and early adulthood. And yung mga psychologists are still uncertain kung ano ba talaga yung responsible prognostic factors kasi mayroong mga temperamental factors and environmental factors such as child abuse, neglect, and others na maaring nakapag-influence sa development nito or sa pag-manifest or pag-trigger ng sexual interest or exhibitionistic sexual interests. As such, mahirap ma-predict or magkaroon ng guide when it comes to sa prognosis, development, and course, severity, persistence ng disorder na ito. And apart from this, ang masasabi lang ng mga psychologists is just like voyeuristic disorder, exhibitionistic sexual interests wane over time daw. Finally is yung mga comorbidity that could co-occur with exhibitionistic disorder. First is yung hypersexuality. Next is depressive disorder, bipolar disorder, anxiety disorder, and others. According sa ating DSM, most of the adult men who were clinically diagnosed with exhibitionistic disorder were convicted for criminal acts after exposure of one's genitalia to unsuspecting adults or non-consenting adults. As such, hindi natin pwedeng gamitin pang generalize itong data na ito for proof sa prevalence ng exhibitionistic disorder within our society. That would be all, and I hope na marami kayong natutunan, and thank you for listening. Bye-bye.